Hello, and welcome to Introduction to Radiology Medical Coding. I'm so glad you're here. This video will guide you through the fascinating world of radiology and the essential part medical coders play within it. Whether you're brand new to the field or brushing up your knowledge, you'll walk away equipped with the tools to succeed. Let's get started. By the end of this video, you'll have a strong foundation in radiology coding and understand how it applies in the real world. And most importantly, how all of this connects back to your responsibilities as a coder. Section 1, the medical coder's role. As a radiology coder, you're a crucial part of the healthcare team. Your job is to assign the correct procedure codes for imaging exams, along with diagnosis codes that explain why the exams were done. It's not just about codes, it's about accuracy and making sure providers are paid correctly for the services they deliver. To do this well, you'll need to understand radiology procedures, imaging methods, human anatomy, and even medications. For example, it's important to know the difference between imaging types like computed tomography, magnetic resonance imaging, and ultrasound. Each one has specific coding requirements. You'll also work with digital tools that store images and patient records. These include software for capturing images, storing medical information, and helping doctors detect problems. You'll review reports, double-check documentation, and assign the most accurate codes possible. This calls for strong medical terminology skills and the ability to understand detailed reports. But your work doesn't stop there. Radiology coders must stay informed about coding regulations, insurance billing, and medical documentation requirements. Mistakes in coding can lead to claim denials and financial losses. It's your job to keep everything compliant and consistent while ensuring that every radiology image is coded correctly and efficiently. Section 2, a brief history of radiology. Let's take a step back in time to understand how radiology came to be. It all began in 1895 when Wilhelm Conrad Röntgen discovered the X-ray, a breakthrough that transformed a scientific curiosity into a cornerstone of modern medicine. In the early 1900s, X-ray equipment was mostly operated by independent businessmen, think chemists, engineers, and electricians. Patients were referred to these operators by physicians for diagnostic or therapeutic services. But by the 1910s, things started to shift. Physicians began purchasing X-ray machines for their own offices, and a new specialty emerged, the radiologist. Since then, radiology has evolved dramatically, becoming an indispensable tool in healthcare and creating a growing need for skilled coders like you. Section 3, where radiology exams are performed, you'll find imaging services in several settings, hospitals and HMO-based systems, which are equipped with cutting-edge technology and expert staff, emergency rooms where rapid imaging can be a lifesaver, urgent care clinics offering quick access but sometimes with less advanced equipment, independent imaging centers which provide high-quality services at competitive rates, and even orthopedic offices now often outfitted with advanced diagnostic tools. Each setting has its own workflow, and understanding these environments helps you assign the correct codes. Section 4, types of imaging techniques. In radiology, the word modality refers to the type of imaging technique used. Each one offers different advantages depending on what the doctor needs to see. Here are the main ones. General radiography, also called plain film or X-ray, it captures still images of bones and internal organs. Computed radiography. This uses a special image plate that must be processed digitally. It was the first step in moving away from film. Digital radiography, a more advanced system where images appear almost instantly on a screen, no need for processing or film. Fluoroscopy, a real-time imaging method often used during surgeries or procedures. A portable version called a C-arm is used in operating rooms. Mammography, this is a specialized X-ray used for breast exams. There are two types, one for screening and one for diagnosing problems. Bone density scans. These are used to check for conditions like osteoporosis. The scan measures bone mineral content. Computed tomography. This method takes detailed images or slices of the body. It's great for viewing internal organs. Magnetic resonance imaging, this uses magnets and radio waves to create images of the body's soft tissues. Some machines can even capture brain activity. Ultrasound. This uses sound waves to create images. It's often used to check on pregnancies, blood flow, or organs. Some types of ultrasound include 3D imaging and heart scans. Nuclear medicine. This involves using small amounts of radioactive material to detect disease. Special cameras pick up the material to create images. Radiation therapy. This is a treatment for cancer using high doses of radiation to shrink tumors. The radiation can be delivered from a machine outside the body or from a device placed inside the body. Section 5. The radiologist. The radiologist is the doctor who interprets the images. They specialize in reading imaging studies and writing reports that describe what they see. These reports guide other doctors in diagnosing and treating patients. Radiologists often focus on certain areas like the brain, the heart, the abdomen, or the bones. As a coder, you'll rely on their reports to assign accurate codes. Section 6. The Radiology Technologist. Radiology technologists are the professionals who actually perform the imaging exams. They position the patient, operate the machines, and ensure the images come out clear. They are trained in anatomy, safety, and the technical side of imaging. Their work directly affects your ability to code accurately, since the quality of their documentation supports the codes you assign. Thanks for watching this Introduction to Radiology Medical Coding. To help you follow along and review what you've learned, I've created a free downloadable PDF with the lesson outline and keynotes. Just click the link below this video to access the free PDF now. This resource is perfect for reviewing concepts, taking notes, or studying at your own pace. You can view it on my website, or download the entire course PDF, which includes all 5 written lessons, each with detailed outlines and notes that match the video content, links below. Don't forget to download it, and I'll see you in the next lesson.